Everyone. Welcome to our Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank you for giving us this great opportunity. And Dr. Sweta Singh, our past Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, Ka Chief Administrator, welcomes our respected speaker, Chairman and CEO Kavita Ma'am, Ka volunteers and all the attendees to Ka webinar. I would like to take the opportunity to introduce Ka Homeopathy Study Group to all of you. Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kuknur, President and CEO of Kavita Holistic Approach, Ka. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing, goodwill, and solid clinical work within the classical model are foundational principles for the Ka. Ka's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, and Achina CPT provider and serves as the associate editor of the Homeopathic Heritage. She is a NASH mentor for North American Society of Homeopaths and life member of NCH, National Center for Homeopathy. She is the recipient of Martha Allman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, the Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Cheema, ex-Director Homeopathy, Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar Homeopathy, the Future Medicine at Kashipur on 21st August 2022. We are proud to announce that Dr. Kavita was honored as a Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA, Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA, with DTA Community Service Award 2023. She also received the Lifetime Achievement Award 2023 by HomeoCure and Research Institute Director Dr. Rajneesh Kumar Sharma, Ka Homeopathy Study Group, Kevin Friendly Foundation, in presence of Chief Guest Dr. Shripad Hegre. Best wishes from Homeopathy 360. We are extremely happy and proud that we have celebrated 13 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, Dose of Spirituality with Kavita, has also completed 3 years on 22nd Jan 2025, which was launched in presence of Honorable Guest of Speaker, American Institute of Homeopathy, AIH President Dr. Alex Becker, and Council for Homeopathy, CHC President Dr. Sheetal Tiwari at our CA webinar. At CA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have listed on the website. Dr. Kavita donated the proceedings of the book through Ka Study Group platform to various charitable organizations and homeopathic associations. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. Interested ones can reach us for details at kastudygroup@gmail.com. As of now, we have over 500 recordings on professional webinars related to homeopathy, health related topics, and inspirational talks. available on our YouTube channel with the name Kavita Kukunu. This webinar is moderated by me and Ka family and Ka volunteer Dr. Deepika Balani. It is being recorded as we speak, and we will take questions at the end of the webinar. We will kindly mute yourself and turn your videos off for better connection. And before proceeding to the scientific session, I would like to invite Dr. Deepika Balani to read Code of Ethics.
Good evening, ma'am. Am I audible?
Yes. Let me share. Yes, please.
First of all, thank you for the opportunity from ma'am and Kavita ma'am that I'm able to read the Code of Ethics today. Ka Homeopathy Study Group Pro Bono Ethics and Benefits. To be a Ka speaker, need at least 1 to 2 months of active volunteering. Only Ka speakers' themes are promoted in newsletters and webinars. Ka provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to our WhatsApp group. Articles of volunteers will be posted on KA website and newsletter and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious KA annual awards. Volunteers are eligible for KA inspirational talks. Volunteers are also eligible for case discussions. KA promotes homeopathic organizations as well as their mega events. KA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KA maintains a healthy and happy environment, so keeps only like-minded folks. KA requests everyone to maintain the confidentiality of the group. For more details, please visit our website www.kavitakhomeo.com.
Thank you, Dr. Deepika. And I would also like to invite you to please read the disclaimer.
Sure, ma'am. Thank you once again. Please note this disclaimer. All the KA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by the speakers, moderators, and attendees are a part of educational experience and do not necessarily represent the position of Kavita Holistic Approach, KA, or KA Homeopathy Study Group Pro Bono. Thank you.
Thank you, Dr. Deepika. Now I would like to introduce and welcome our honorable speaker, Dr. Rajneesh Kumar Sharma, sir. And he is MBBS, BHMS, MD, and PhD. He is KA advisor and privileged and is executive member of Delhi Homeopathic Medical Association. He's a life member of Homeopathic Medical Association of India and Indian Institute of Homeopathic Physicians, life member of Indian Medical Legal and Ethics Association. He is a medical examiner of Life Corporation of India, executive editor of the Hahnemanian Homeopathic Sandesh, a peer-reviewed journal by DHMA. He is a faculty to several national and international conferences, recipient of many international and national awards. He's the author of numerous research papers, articles, case presentations, and books. He's a chief managing director of HomeoCure and Research Institute, Webber Homeopathic Pharma, and Spurge Multi-Specialty Hospital. And he'll be speaking the topic, a case of unicameral bone cyst cured with homeopathy. Welcome, Dr. Rajneesh, sir, to KA platform, and please proceed with your session.
Thank you very much. Let me share.
Yes, sir.
There is a case of unicameral bone cyst cured with homeopathy. All of you have seen several miracles in your life, but miracles do occur, but rarely. But in homeopathic practice, you can see miracles, they occur very frequently. Numerous cases which are termed as incurable ones are frequently cured with homeopathic constitutional treatment under the hands of a number of homeopaths, all of you, for a very high frequency, and you are seeing miracles in your clinics also, and you are listening about the miracles occurring in other homeopathic clinics also. This is a case of unicameral bone cyst of femur, tibia, and fibula in a girl who was just 8 years old. She was dark complexioned, she was lean, she was thin girl, and she got completely cured and with disappearance of all the unicameral cyst with constitutional homeopathic treatment within a short period of time. This is an evidence-based case study. Let us just read something about unicameral bone cyst, because this is a very rare entity, and a number of doctors, including allopaths, are not used to treat the unicameral bone cyst. Some orthopedic surgeons are doing treatment of this unicameral bone cyst, and this is not in the syllabus of MBBS, BHMS, or MD. Therefore, we have to learn something about that. This unicameral bone cyst, or UBC, is a benign fluid-filled lesion that occurs primarily in the metaphysis of the long bones in growing children and adolescents. This is self-evident that this is a disease of growing children. When bones used to grow in length, there are some air bubbles that are left within the cavity of the bones, long bones, near the epiphysis. This is called a unicameral bone cyst. Other names are simple bone cyst or juvenile bone cyst, because these are occurring in the children. This was first described by Zafir and Lichtenstein in 1942 after the discovery of X-ray. Unicameral bone cysts, which are also called, I have already told, the simple or solitary bone cyst or benign bone cyst. These are benign fluid-filled cavities that enlarge over time. They grow over the time, resulting in the thinning of the bone. As the cyst grows in the size, it thins up the cortex of the parenchyma of the long bones, and increases the tendency to the fracture. Usually, these cysts are found in the metaphyseal areas of long bones with open physes. Most of the unicameral bone cysts are found in children and adolescents. These are more violent in the first decade of life, because in first decade of life there is a faster growth of the bones. The proximal humerus and femur are mainly affected. This is rare in distal part of the long bones. This is common in proximal part of the long bones, which are humerus and femur. Sometimes it also appears in the proximal part of the tibia. These may be active or latent. The unicameral bone cyst is called active when it is adjacent to the growth plate of the long bone and it has higher recurrence risk. And it is called the latent cyst when it is away from the growth plate and it has lower activity and it often heals with the age. Then you can see whenever unicameral bone cyst is near to the growth plate, it is very active and it has very high recurrence rate and it grows up continuously and it leads to the fracture of the bone. Whenever these are within 1 centimeter from the physis, these are near to the epiphysis, this is known as active, I have already told. And whenever these are away from far away after 1 centimeter, these are known as latent. And these are also called latent when they reach to the diaphyseal location of the long bones. You can see in the diagram. This is the this is adapted from the Gray's anatomy. The aneurysmal bone cyst, fibrous dysplasia, enchondroma, and intraosseous ganglia are to be kept in differential diagnosis, because unicameral bone cysts are very similar to the fibrous dysplasia, aneurysmal bone cyst, enchondroma, and intraosseous ganglions. But the time of by the time of skeleton maturity, small, very tiny unicameral bone cysts tend to resolve, but the larger ones they tend to grow in the size. For larger lesions, modalities include in allopathic treatment or modern treatment, the modalities are intraluminal injection of steroids, open curettage, bone grafting, decompression, percutaneous injection of the marrow or graft substitutes, and sometimes minerals are injected into the cavities of the cyst to get them filled up. Constitutional treatment with homeopathic medicine gives a wonderful response in such type of cases. I have seen a few cases, but this is a single case. This was a miraculous one. What are the causes of the unicameral bone cyst? The cause is still unknown. There are various theories. Venous obstruction theory is there. Due to continuous growing of the bones in the adolescents or children, the intraosseous pressure is increased because periosteum is very hard, and with the development of the bone marrow, there is increased intraosseous pressure, and which compresses the blood supply inside the bone, and that compression of the blood supply causes the obstruction of blood flow and growth of the bone that is restricted in certain areas, causing the vacant area, which are known as unicameral bone cyst. Sometimes growth plate related lesions are responsible for that, and sometimes trauma may be there. These are lined by a thin membrane with serous or serosanguinous fluid. In some unicameral bone cyst, there are serous fluid, and in some serosanguinous blood and serum mixed. This type of fluid is filled there. How can we diagnose that? By plain X-ray. These are centrally located, well-defined osteolytic lesions. They have thin sclerotic rim, sharp lining of the bone. No periosteal reaction is there unless fracture. Whenever fracture is there, we will see a periosteal reaction and a callus formation in the around the cavity of the this unicameral bone cyst. And the pathognomic sign is fallen fragment sign. Sometimes a fragment of the bone seems to be fallen inside the cavity of this cyst. This is known as fallen fragment sign. In MRI, there is visualization of hypointense lesion in T1 and hyperintense lesion in T2 image. In CT scan, for cortical integrity, the fracture planning, we have to do CT. The CT explains the cortical integrity and makes the plan of the treatment, whether this is to be removed surgically or to be treated with medicines. These are the example X-rays. A and B are the X-ray plates, AP and lateral views of the ankle joint, and C and D are the CT scan of the same site. You can see the appearance of the look of the unicameral bone cyst. These are the cysts. There are two cysts. You can see in the lateral view of AP view also, and in CT you can see that these are multilocular. This is the main cyst, and this is the partition, and this is solitary cyst. And this is periosteal line. As far as clinical feature is concerned, these are often asymptomatic and often found accidentally with X-ray when done for another reason, for pain or for injury or anything, or for confirmation of the age of the patient. The symptoms are dull ache or dull pain, and sometimes there are night pains in such type of cysts. And pathological fracture is not uncommon in a condition which is stress, slightest stress or sport injury. There is a occurrence of the pathological fracture. There is deformity. If the cyst is very large or cysts are very recurrent, there is deformity of the bone. As far as differential diagnosis is concerned, I have already discussed aneurysmal bone cyst, fibrous dysplasia, non-ossifying fibroma, and chondroma, giant cell tumor in adults, and sometimes infection. These are called as Brody abscess. Brody abscess often look like unicameral bone cyst because Brody abscess is filled with pus, but the consistency of pus is thicker, and in X-ray or CT scan, the content of the cavity can be defined, whether it is serous or serosanguinous or pus. Pus often looks dark gray and serous blackish. There are treatment options: steroid injection, stability technique. The steroid is injected in the lumen of the unicameral bone cyst. Multiple injections over the months are needed. Sometimes injection into the bone marrow to stimulate the healing of the cyst. Sometimes curettage and the cyst is opened, that is curettage, and bone grafting is done. Sometimes intramedullary nailing or cannulated screws are fastened in the cavities for mechanical support and healing, and sometimes combined methods are used over the four for better results. What was the prognosis? Prognosis is good in most of the children, but for larger cysts, the prognosis is not good due to complications like bone deformities and fractures. Complications are recurrence, growth disturbances, and pathological fractures. Now, in recent advances in treatment, there is use of demineralized bone matrix injected into the cavity of the cyst, and sometimes bone substitute like calcium phosphates are injected, and percutaneous reaming and decompression is done, and biological and regenerative medicines are studied in recent advances. Now, as far as supportive measures and complementary medicine, with rich calcium diet, rich phosphorus diet, vitamin D, proper rest, protection from trauma, gentle physiotherapy to stimulate the healing, and regular follow-up with repeated X-rays in time. The homeopathy is the best treatment option for unicameral bone cysts. The principle is treat the patient as a whole, not the cyst. This is the holistic approach. Constitutional remedies used here. This is based on individualized constitutional treatment remedy, miasmatic background, clinical similarity to remedies with bony affections are used here. Our objective is to stimulate the innate healing response of the bone to heal up the cyst spontaneously, to prevent its recurrence, and to avoid the surgical interventions whenever it is possible. As far as miasmatic background is there, the basic miasm is tubercular miasm because it is destructive. Wasting bone conditions are there. There is recurrence despite a hectic treatment. There is family history of tuberculosis or chronic illness in some patients. And another active miasm is there, that is syphilitic miasm, which causes night bone pains, necrosis of the bones, and destructive lesions, which appear recurrently in the bones. And often they are mixed miasmatic background in all the cases having unicameral bone cysts. There are certain key remedies to treat the bone cyst. First one is calcarea phos, the bone development issues in children, delayed healing, cystic swellings, desire for smoked meats, worsen cold. Second one is silicea in weak children, slow healing bones, suppuration tendency, chilly persons, and sweaty feet. Another one is symphytum, bone injuries, fractures, cysts, promotes callus formation. Another one is Hecla lava, expensive bony swellings, cysts, jaw affections. Phosphorus is there in tall, slender individuals with hemorrhagic diathesis and early decay tendencies. Fluoric acid is there with degenerative bone changes, destructive lesions, deep pain, better by cold. And calcarea floor is there, which has hard cysts, bony exostosis, cracked, brittle bones. Now we will be discussing the case. I have told already. The girl was 8 years old, having dark complexion, lean, thin body, who presented with recurrent pains in lower limbs, which were worse in night. You have to note the pains were worse in night and were recurrent pains in lower limbs. The pains were severe whenever she used to run or walk long distances in daytime. The pains were of stitching nature. This is the point to be noted. The pains were stitching and were aggravated in night whenever the patient used to run or walk long distances. These pains were appearing in night only with position of rest. She craved for the fat food and indigestible things like sand, clay, chalk. She had a strong aversion to cheese and suffered from bad stomach and bowels after taking milk. The milk was not digestible at all. She could not bear cold weather as it affected her badly and did to catch cold easily. She was used to take cold easily, and she was a very chilly patient. She has a violent temperament. temperament was so loose. She was having violent anger. Once she quarreled with her best friend and lost friendship. The anger was so violent. She suffered for several days with anguish for that. Her mother had a history of abdominal tuberculosis. The repatriation will be done with the points hidden inside the test. She was accidentally diagnosed to have unicameral bone cyst on X-ray done at AIMS for her leg pains on 4/7/2018 and prescribed vitamin D and calcium supplements. On reviewing, the size of cyst was increased considerably within 6 months. In spite of calcium and vitamin D and various supplements at AIMS, the size of cyst increased considerably as per scan done on 22 December 2018. Homeopathic treatment was started on 15 August 2019 and repeated scans were taken at times. Continuous improvement was seen and the lesions disappeared ultimately after a course of about 3.5 years. It took a considerable time of treatment, 3.5 years, because after 6 months of treatment in AIMS, the cyst was almost doubled, and after 3.5 years of homeopathic treatment, all the cysts disappeared. The constitutional analysis was done with the help of repertory in the computerized repertories, opus, and the minimum remedy was found. The case was started with remedy based on a family history, which was tuberculosis of the abdomen in the mother, followed by a constitutional remedy. At longer intervals, repetitions were not done, and high potency was used. First dose was anti-miasmatic remedy with mother's history of abdominal tuberculosis. The constitutional remedy was the minimum one based on mentals and physicals. Since mental symptoms and generals were covered exactly, the higher potency was selected. The case was completely cured within 3.5 years of the treatment, and all the cysts got disappeared, and her mental symptoms were entirely changed to mild temperament. The homeopathy treatment entirely transformed the life of the patient, and she was, after the treatment, just a gentle, calm child. You can see the sequence of the X-rays done. The sequence of scans show increase in lesions without homeopathy support in film 1 and 2. The film 1 and 2 are at the AIMS. You can see the size of the cyst, this was very small, and in this, the size of the cyst is very large in both the legs. This is the left, and this is the right. This was the treatment at AIMS. And these films are with homeopathy treatment. This is the scan in film 3 when the patient approached the homeopathic treatment, and after 3.5 years, there is no sign of unicameral cyst or any type of the lesion in the bone. You can see. This is a case analysis. The first point was violent anger, and after quarreling with her best friend, the anguish after loss of friendship, desire indigestible things, milk aggravates, tendency to take cold, aversion cheese, desire fats, mother had cox abdomen, nightly limb pains, lean thin build, dark complexion, and pains were of stitching nature. This is the repertorization. You can see all the rubrics are there. Violent anger, anguish after losing the friendship, lean pupil, fat desire, cheese aversion, milk aggravation, lime, slate, pencil, or chalk clay desires, cold taking a tendency, dark complexion, pain, legs, night, and family history of tuberculosis. The remedies are nitric acid, ignatia, sulfur, calcarea carb, nux vomica, phosphorus, tuberculinum, letalum, and so on. The treatment I've already explained. Tuberculinum 1000 on day 1, no remedy for a week on the basis of tuberculosis of the mother. After a week, acid nitric 1000, 1 dose every month was given, and placebo was given on HS basis. The same treatment continued for 3 years and 4 months regularly. It took 1 dose of tuberculinum 1M and 42 doses of acid nitric 1M to get this miraculous cure. Result was a complete cure with anti-miasmatic and constitutional remedies. This is the collection of all the scans. This is a search for other unicameral bone cysts in the humerus or chest, in the long bones, in the lower limbs, in the pelvis, and this is the random collection. The unicameral bone cysts were also searched in the cranium by the AIMS, but there was no evidence of unicameral bone cyst on the cranium. You can see each and every scan, which is self-explanatory, and this is the last one which was having the normal bones. There is no evidence of cyst. The references for this are taken from Zaffe and Lichtenstein, the bone cyst, simple and aneurysmal, stability at all, clinical orthopedic and related stuff, and orthopedic. Thank you very much. This was a short case and was miraculously treated with homeopathy and was cured miraculously. Thank you for listening.
Thank you so much, sir, for such an enlightening session. Do we have any questions to our speaker? Please unmute yourself and you can ask if you have any query.
I think there is no question.
It's okay. And we would like to take the privilege to honor our speaker with KA Appreciation Certificate. So please accept it from KA Homeopathy Study Group, sir. Just share. Thank you, sir, for your gracious presence and for sharing your precious time and knowledge and wisdom to us. And with this, we are winding up the session. It was very short and very enlightening, knowledgeful. And if you have any query, you can email us at carstudygroup@gmail.com. And we are having a lot of such knowledgeable sessions for all of you. So keep checking our social media handles for all the information. Thanks to our honorable speakers. Heartful thanks to our viewers and followers to join us today. And for the upcoming webinar info, you can follow our upcoming our social media handles like Instagram, YouTube, uh, LinkedIn, Facebook, and Twitter. And if you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kuknur. And I'm really thankful to our CA volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info and for your participation certificate, please reach us at castudygroup@gmail.com. Thank you so much, everyone. Good night. Thank you so much, sir. Goodbye.